Welcome to Tailblazers Talks. Today we'll be discussing dental health. According to the American Veterinary Dental Society, 80% of dogs and 70% of cats show signs of oral disease by age 3. It is so important to monitor and care for your pet's dental health since untreated periodontal diseases can spread through the bloodstream and lodge into other organs. Not to mention, it can cause severe and unnecessary pain. Our main focus in dental health is periodontal disease. There are a few stages involved in periodontal disease. Stage 1 being plaque. Plaque is a soft, gummy film of bacteria that accumulates after eating and sticks to the teeth. Plaque is typically colorless. In the early stages, does not smell, but any food particles sitting around for too long can lead to an unwelcome smell. And plaque usually feels a little fuzzy on the teeth. Stage 2 is tartar. Plaque that is not taken care of properly forms into tartar, which has a firm attachment to the teeth. Tartar is a yellowish brown in color. Once tartar forms, so does bad breath. Tartar also makes it more difficult to clean the teeth, so it's more difficult to get rid of, and usually requires a professional to take care of. Tartar usually feels rough and raised on the teeth. Stage 3 is gingivitis. Gingivitis is the next occurrence after tartar and occurs when tartar starts to grow and dig into and below the gum line. This makes the gums loose and the tartar buildup can easily increase. You'll usually see a buildup of tartar as well as red and irritated and inflamed looking gums. With gingivitis, the smell of the mouth is getting worse. Gingivitis can cause the gums to feel swollen and usually comes with the start of pain and irritation as well. Stage 4, periodontitis. Now that the tartar has breached the gum line, it's secreting toxic substances, causing further tissue damage. At this stage, the pet's body will try to step in and help. They start to send white blood cells to the affected areas. Because the white blood cells are fighting the infection so hard, the teeth can become compromised and therefore lose healthy tissue. You'll notice a buildup of tartar as well as red, irritated, and inflamed looking gums. You'll notice that the smell of your pet's breath is getting worse. Your pet is likely experiencing mild to moderate pain. Stage 5, tooth rot abscess. Now that the healthy tissue has been damaged, the tooth is susceptible to further damage. The bacteria in tartar can now gain deep access to the roots of the teeth. After access, the bacteria can destroy the root and cut off blood supply from the jaw, causing the tooth to die. The pet's body steps in once again to try to protect them, and this forms an abscess. You'll notice a buildup of tartar, as well as red, irritated, and inflamed looking gums. The affected tooth is now loose. The pet will be avoiding eating on that side of the mouth, and there may be swelling directly under the eye. You will notice that your pet's breath is getting worse in smell, and this process can include pain in the mouth as well as under the eye and is more severe. Stage 6, loss of teeth. Once an abscess is formed, the tooth may be getting ready to fall out. However, it is causing the pet tremendous pain and it can take a while to fall out. This may also be a time a veterinarian needs to step in to remove the affected teeth. You'll notice a buildup of tartar as well as red, irritated, and inflamed looking gums. The affected tooth is loose. The pet will be avoiding eating on that side of the mouth. There may be swelling directly under the eye. Teeth may be falling out or loose. At this stage, you'll notice that the smell is tremendous because not only is the tartar buildup causing smell, but the rotting tooth and pus-filled abscesses are as well. The pain in this stage is more severe and includes pain in the mouth as well as under the eye. However, there is relief when the tooth falls out or is removed. Those are the 6 stages of periodontal disease. This can happen quickly, and sadly, most pets that have terrible breath or tartar buildup are usually suffering from one of these stages of periodontal disease. What's worse is what these conditions lead to. It's not only your pet's mouth that's suffering from this disease, but their whole body can be affected. Periodontal disease can lead to the malfunction or failure of some of your pet's major organs, like the nervous system, kidneys, liver, and heart. What puts your pet at risk? Let us identify what can cause dental disease. Number 1, inappropriate diet. High levels of sugar and carbohydrates, typically found in kibble diets, can cause oral bacteria, leading to plaque and tartar buildup. Dental problems have also been associated with highly processed pet foods made with cereal grains. The top 3 cereal grains that cause dental disease are wheat, corn, and rice. Number 2, inappropriate dental care or cleaning by the owner. By allowing the buildup of tartar, you are putting your pet at risk. Brushing daily can help with this problem. Start your dog young if you can. It'll be easier to manage in the future. Number 3, diabetes or Cushing's put your pet at higher risk to develop dental disease. Number 4, brachycephalic breeds such as boxers, bulldogs, and King Charles Spaniels tend to have more dental issues due to the rotation and crowding of teeth in their mouth. Some of these risks may not be in your control, especially if you have a brachycephalic breed, but it doesn't mean you can't work on preventing it. We'll get to that later in the prevention section. First, we'll take a look at our conventional veterinary treatment. Veterinary prevention includes, number 1, brush, brush, brush. Brushing teeth on a daily to weekly basis can severely lower the chances of plaque turning into tartar. If your pet has reached the tartar buildup stage and the veterinarian has taken notice of it, they may suggest that you start to brush your pet's teeth on a more regular basis. They may also start suggesting dental cleanings at the vet. Number 2, regular veterinary dental cleanings. Starting at 1 year of age for cats and small to medium breed dogs, and by 2 years of age for large breed dogs, it is suggested as dental care by veterinarians. The vet will insist on deep cleaning of the gums and teeth to remove all plaque and tartar. Without anesthesia, this can cost between $300 to $700, and with anesthesia, this can cost from $500 to $1,000. Included in the cost, you will receive an X-ray to examine what areas need the most attention, as well as to ensure that the tooth roots are all healthy and nothing requires removal, as well as a pre-examination of teeth, gums, tongue, cheeks, and roof of mouth, checking for periodontal disease. You'll receive scaling the teeth, which is removing tartar, and tooth polishing to improve discoloration. Not included are tooth extractions or root canals. These can add an extra $1,000 to $3,000. Each root is about $1,000, and some canine teeth have 3 roots. Antibiotics and extended stays at the vet are also extra cost. The biggest issue that we see with veterinary cleaning is anesthesia. Anesthesia during evaluation and cleaning comes with a whole load of other complications. On the table, the pet is more likely to suffer from cardiac arrest or stroke, and then ongoing issues like organ failure, clotting disorders, and seizures are all risks after the anesthesia has worn off. We also take issue with the prescribed veterinary diet, dental care. The veterinarian will likely suggest their line of dental care food at the tartar level or higher. Let us explain why we have an issue with it. Prescription diet breakdown. Let's break down some popular veterinary care dental prescription diets and treats. Number 1, Purina Pro Plan Veterinary Diets. DH, Dental Health Dry Feline Formula. The key features of this food include proven to significantly reduce the buildup of tartar and plaque, patented kibble texture, high quality nutrition for every feeding of adult cats, and VOHC, Veterinary Oral Healthy Council, seal of acceptance. This diet's first ingredient is ground yellow corn. This is a cereal grain and was given as a high risk factor for causing dental disease, not to mention the other health risks associated with corn in the pet food industry. It also has a carbohydrate content of 27.6%, which is high for a cat who should be eating a diet with 2% or less carbohydrates. A cat's body does not know how to break down carbohydrates this high, so in turn, it can actually affect their entire system, causing a multitude of problems including dental issues, digestion, obesity, and can even cause diabetes. Food number 2, Royal Canin Canine Dental Small Dog Dry Food. This food's key features include clinically proven to effectively reduce tartar buildup, specific kibble shape and size to help reduce plaque accumulation and tartar buildup by promoting a brushing effect while chewing, promote diluted urine, which helps reduce the risk of crystal formation. This diet's first ingredient is brewer's rice, which is another common cereal grain for dental disease. Corn is the second ingredient, and wheat gluten is the fifth. All 3 top cereal grains are in the first 5 ingredients. This is not a good sign. The carbohydrate content in this food is also at about 35%. Dogs are much better at digesting carbs. However, they still shouldn't have such a high and unhealthy presence in the food. Healthy carbs should be present in the food from vegetables and fruits, and less or not at all from cereal grains. Because the key features mention kibble size, let's debunk that statement. Kibble does not and has never been able to clean pets' teeth. It is the equivalent of humans using granola to clean their teeth. If you chewed granola every day for a week instead of brushing your teeth, what state do you think your dental health would be in? Number 3, Hill's Prescription Diet. TD, chicken flavor, dry dog food. This food's key features are cleans teeth and freshens breath by removing plaque and tartar, promotes healthy gums by cleaning up the gum line, vital nutrition for daily health and immune system support. Again, this food ingredient list lists 2 of the 3 cereal grains as the first 2 ingredients, so it's not appropriate for dental care. When you go to the dentist to have tartar removed, how does it feel? Do you think that you could have done it at home by chewing on something crunchy, like a really hard cracker? Personally, I don't think that's enough, and I'm sure your dentist would not encourage it as a solution. So why is it being suggested as a solution for your pets? A human dentist would likely suggest a diet less likely to cause plaque to begin with, which means a diet high in nutritional benefits. They would suggest food items like fresh vegetables and fruits, nuts, meats, and fish, as well as plenty of water. Funny enough, they don't suggest cereal grains at all, and actually suggest limiting them in your diet. Now that we've explored what a conventional veterinary treatment and food looks like, let's take a look at a natural treatment. Natural treatment. As an example from my life experience, I adopted 2 dogs at age of 1 year old. My first dog, Bella, was adopted in 2016. She is approximately 7 years of age now. My second dog, Sam, was adopted in 2020 and is now 4 years old. As 1-year-old dogs, there was not much wrong with either of their dental health, and we wanted to keep it that way. I switched them to a raw food diet and included a lot of chews in their diet as well, including turkey necks, marrow bones, and Bella's personal favorite, bully sticks. In my 6 years of owning Bella, I've never had to brush her teeth or visit the dentist for a dental cleaning. She has always passed her dental checkups with a gold star. She has a small amount of tartar buildup on her left canine tooth, which is likely from her being fed our travel diet, which is kibble, or being given crunchy treats every now and then. However, it's not a concern for her. Her breath doesn't stink, and she has no trouble eating. She's never shown any signs of dental discomfort. As well, the tartar is not approaching or impeding the gum line, so we're nowhere near reaching the gingivitis stage. Sam has no visible signs of any dental issues. His teeth look like they belong in a model magazine. I mention my own experience because I can say that it works for my pets. And with Tailblazer's 20+ years of experience suggesting this diet and feeding style, we know that it works for our clients' pets as well. So here's our suggestion as a preventative measure. Number 1, switch your pet to a natural diet, one that supports their biology and healthy digestion. For dogs, that means a raw food diet, including fruits and vegetables. And for a cat, that means a raw food carnivore diet, including little to no vegetables. Cats don't eat veggies or need them. they should only be present in small amounts of less than 5%. If not possible to feed raw, add as much moisture to your pet's diet as possible and try to feed a diet low in carbohydrates. Number 2, use healthy dental chews often. This includes raw bones. We know bones can be messy, but you can give them outside or train your pet to eat them on a mat, towel, or in their kennel. Once they get the bone, not much else is on their mind but eating it, so they won't be moving around a lot. Also, raw bones contain natural vitamins and minerals like calcium that can help dramatically with dental health. Best raw bones for dog dental care. Dogs are usually easy. Most will eat anything you put in front of them. I like to suggest turkey necks or chicken necks to start, depending on the size of your dog. Necks are a great first-time raw bone. They're even sometimes referred to as nature's perfect toothbrush because dogs will use their back teeth to break down the vertebrae, which clean the molars. I use turkey necks once a week for my dogs, and since they're medium-sized dogs, the turkey neck can be used as a meal replacement as well. Best raw bones for cat dental care? Most cats love to chew, so getting them in a chewing pattern may be easier than you think it is. The best chews for cats are chicken necks and Cornish hen feet. The necks work in the same way as they would for dogs, so they're a great addition to any feline diet. Other dental chews include plaque off, which uses kelp to balance the bacteria in the mouth, crumps, which are made with oyster shells to mimic the scraping of dental instruments, and bully sticks. Bully sticks are by far my favorite cooked dental suggestion for pets. Cats and dogs both can eat them. They're easily digestible and they won't splinter. When your pet starts gnawing, the stick becomes softer from saliva and can really get into the hard-to-reach places. It almost acts like dental floss for pets. Not to mention, saliva production can help with keeping healthy bacteria in the mouth. Number 3, if your pet already suffers from dental issues, start with a cleaning. Professional dental hygienists and pet lovers have noticed the need for affordable pet cleaning and offer services nationwide to help with the problem. It costs less than the vet visit, they use natural products like colloidal silver, and is only offered to clients whose pets are suffering from the lower end of periodontal disease, like gingivitis or less. These practitioners do an amazing job and do it without anesthesia. They will not work on pets who are in pain and need veterinary assistance. Google search for pet dental cleaning in your area and find a well-rated option. These services also usually come to you, so it's extremely accessible. Number 4, if you have noticed a small amount of buildup, start prevention with a supplement. Since digestion plays a key role in dental health, we suggest using a few natural options, like apple cider vinegar to improve digestion, sea kelp, which improves digestion and keeps bad bacteria out of the mouth. This supplement is used in many dental supplements, including plaque off, chews, and powder, and colloidal silver, which eliminates bacteria in the mouth. 5. There are also more specific dental supplements that you can use, like Leva 3, which has been shown to remove significant tartar buildup. This is what I would suggest for more extreme cases, but I would suggest using it alongside colloidal silver to keep the mouth bacteria healthy and mouth wounds clean, since it can work as an antibiotic. With over 20 years of experience in helping pets naturally, we've seen what works and what doesn't. Pets that have taken the conventional route are stuck in a vicious cycle. They're constantly at the veterinarian, getting cleanings and filling up their dental food prescriptions. We have a better way, one that not only offers a more appropriate and rotational diet, but a healthier way of living. If your pet is suffering from dental disease, no matter what stage, stop by a Tailblazers location near you and experience the benefits of your pet being Tailblazers healthy.